Hello everyone, hope you all are fine and you are also doing preparation for your exams. Earlier we discussed about sports injuries, their causes and prevention. Nobody is sure about 100% prevention of injuries in the games and sports because there are many causes through which injuries can be happen anywhere, anytime with anybody during practice, during competitions or during training. So next question is arise if the injuries are happen, how to manage the injuries and how to treat to the wounded or injured person. So today we will discuss about management of injuries. There are type of injuries like soft tissues injuries, bone injuries and joint injuries which are happen into the games and sports during different kinds of activities played by the sports person. Firstly, we will discuss about management of soft tissues injuries. Soft tissue injuries like contusion, abrasion, strain, sprain, laceration, which are to be happen due to some kinds of minor or major incident or accident during practice or training and competition in the games and sports. So, firstly, contusion. Contusion is the injury of muscles. So if the injuries can be happen immediately, cold compression can be used for the management. Consult to the doctor if the pain is more. Then give them some kinds of inflammatory medicine or some painkiller can be given to the injured person. Cold compression should be used 5 to 6 times in a day around 30 to 40 minutes. Next is abrasion. Abrasion is also a muscle injury. If the abrasion is happen, first of all clean the affected part, use some kinds of fresh water and some kinds of clean clothes or you can use sterile gauze to clean the affected part. After that use some kinds of ointment for the dressing or if possible you can go to the doctor for proper dressing. Dressing can be changed properly into the daily or after doctor suggestion. Next is sprain. Sprain is a ligament injury and there are mainly two types of procedure which are to be followed to manage the sprain. First is price. Price is a complete procedure which has to follow to manage the sprain around 24 to 48 hours. Here some kinds of definition of price is P. P for protection. First of all, protect the injured part, give some support or use some shoes. Next is R. R for rest. Give complete rest to the injured part so that swelling or pain can be also reduced. Next is ice. Ice can be also applied as soon as possible around 5 minutes to the all affected part or around to the part 4 to 5 times in a day. Next is compression. Compression helpful to reduce the swelling and bleeding. Compression should not be applied very hard. It is also harmful for blood circulation. Next is elevation. If possible, try to elevate the injured part on a pillow. It is helpful to reduce the swelling and elevate the part above to the heart level. It is also helpful to stop the bleeding also. Price procedure is also helpful to manage strain injury also. Next procedure to manage the strain is MICE. MICE, M is representing to the mobilization. Movement of the injured part should be checked regularly. Avoid such movements which cause pain. It will help you to prevent bursting of muscle through lack of use. Apart from this, some other injuries like laceration or incision can be happen into the games and sports. In these injuries, bleeding can be comes out from the skin and it is happen due to some sharp edged object. Management of this injury is trying to stop and control the bleeding as soon as possible. For that, trying to hold the part which is injured for 10 to 15 minutes around. After that, use some warm water to clean the affected area and then use some kinds of antiseptic ointment like betadine if the injury is minor. Cover the area with sterile gauze and wrap the roller gauze. Painkiller can be given if the pain is more. and then dressing can be changed regularly. If the stitches are required, then call or go to the doctor immediately. Next is management of bone and joint injuries. Bone and joint injuries are immediate required some medical help. So firstly call to the medical assistant, then some steps are to be followed before reaching to the doctor. First of all, injured part should not be moved. Give some support to the fractured or dislocated part, or give some hard support with the help of some solid sticks. Trying to avoid some kinds of movement in the particular part, and give them some painkiller if the pain is more, or keep that part up to avoid the swelling. These kinds of some general steps which are to be followed during fracture or dislocation before reaching to the doctor. These steps may avoid some kinds of emergencies. Here we had discussed about some management of sports injuries which are happen into the different kinds of games and sports. For the management of sports injuries, concerned person should have enough knowledge about first aid. First aid, the first help which is provided to the wounded or injured person to avoid some kinds of emergency. Today, world has progressed in various fields like transportation, industrialization, games and sports, science and mechanism. On the other hand, this kind of development has also increased the risk of injuries anywhere, anytime with anybody. There are many kinds of games and sports or other field which are kinds of incident, accident and injuries are to be happen with anybody. This happen due to some kinds of careless mistake, or sometimes it is happened by chance. At the time of happening, some kinds of immediate help is required, that is called first aid. So many chances of kinds of happening in the games and sports, so physical education teacher should have enough knowledge about first aid, so in any kinds of emergency in these games and sports they can save any life. There are some aim of first aid. That is, first is save the life. First aid can be save the life of a person who is injured, and if he or she can get immediate help, their life can be saved from emergency. Next is reduce the pain. First aid, the main aim is to reduce the pain, to provide some kinds of help where the pain is to be reduced by some kinds of methods. Next is prevent minor injuries. First aid aim is to prevent minor injuries convert into the major injuries. Sometimes due to some kinds of careless mistakes, some minor injuries can be converted into the major injuries, or that can be also harmful or dangerous for the life. Next is early medical help. First aid is the first help to provide to the wounded or injured person. It is the first medical help before coming or before reaching to the doctor. So this kind of help can be also save the life of the injured person during any kind of emergency. Students, hope you will understand about all these concepts and topics which we had discussed. So from my side, chapter number 7, sports physiology and injuries in sports has completed. If you have any doubt, queries, you can ask. Now next I will come with new topic. I will be waiting for your queries and doubts. Thank you so much for watching this video.